It is ironic that our colleagues, our closest colleagues in the operating theatre are anaesthetists, and they were amongst the first to create an association in Mauritius. It took us surgeons a bit longer, and I'll leave that to your own thinking, maybe as to why we were so behind. I am personally very grateful and honoured indeed to have been chosen as the first president of the Minimally Invasive Surgery Association, MISA for short, and it is indeed a great privilege and which I intend to put to good use. Surgery, as you know, is one of the most exciting specialties in medicine, and it really harks all the way back to warfare. And warfare has actually been one of the main catalysts for the advance in surgery. And today, as you all know, surgery encompasses a wide field, from providing cure to well-selected cancer patients to a whole host of non-cancer conditions, ranging from trauma to infection, inflammation, system restoration, or even replacement. And now, and as Secretary mentioned, minimally invasive surgery is really the next big step. It was really the big step at the end of the 20th century, taking surgery to a level where patients would be recovering faster with less suffering. Our little island of Mauritius has indeed benefited from a long line of talented surgeons, and certainly surgery has been a mainstay of medical care in the 20th century, and there's very good documentation of complex surgery being done in our hospitals for at least the last century. And we feel, and this is the reason for this association, the next step is to formalize the careful implementation of minimally invasive surgery in Mauritius. Sadly, as I mentioned in the beginning, there has never been a local body of recognition for surgeons. And I think it is high time that we got together to form this association, and in enhancing friendship among surgeons and enhancing knowledge between us, which would ultimately benefit surgeons and our patients alike. And this association, as Secretary mentioned, would also extend our connections internationally. I found it interesting to note that Princess Victoria Hospital, which you all know as Congress Hospital, was still a training center for British surgeons until the early 70s, meaning Mauritius was part of the surgical training program for British surgeons until then. I think that's a very clear indication of how good we can be in Mauritius, and certainly be on par with the world's best. I think it's also, we all think it's a very opportune time for this association to form, because as you all know, we are now living in an era of very easily available information. And our friend, Dr. Google, has made life a lot more challenging in many ways. The days of doctors being paternalistic and challenged in the approach to patients, I think, is long gone. And in today's medical practice, it is more of a two-way dialogue with patients, and between the patient and the doctor, and certainly for a full informed consent. Likewise, this era of rapid technological advances, with our busy schedule, it is indeed very difficult to keep abreast of all the latest changes. And this association should fulfill that key role of uniting the surgeons to keep up to the latest information in surgical advances. Our vision, indeed, and I take on the point from the Secretary, is indeed to work to a minimum standard of minimally invasive surgical care. And to this effect, we are planning our first Congress in October, and hopefully a first surgical journal for Mauritius as well. This is, I think, even more important on the island, as we have surgeons trained from all corners of the world, and it would be commendable to standardize practice as much as possible. So, I've really listed very ambitious goals indeed. We certainly believe that we must aim very high. I think whilst moving forward very humbly in our specialty, ultimately for the benefit of all our patients and society at large. So thank you very much for attending this real founded association.